Hello and welcome everyone. Myself Mijanur Rahaman, and today my topic of discussion is autoimmune disease. So let us start. So first of all, we will come to know that what is an autoimmune disease. So first of all, our topic is to know what is the autoimmune disease. So the immune system mistakenly when attacks the body's own healthy cell, that is known as the autoimmune disease. So what is autoimmune disease? Autoimmune disease is nothing but that whenever our own immune system mistakenly attacks our own body's healthy cells, okay, and it fails to distinguish between the self and foreign individuals. So what happens here? It fails between distinguish between self and foreign particles or invaders, okay. And there are 80 known autoimmune diseases. So there are how many immune diseases? Now, till now, nearly about 80 autoimmune diseases are present. So first, what is an autoimmune disease? Autoimmune disease is the immune system mistakenly attacks the body's own healthy cells, that is autoimmune disease. And whenever a autoimmune disease occurs, the body fails to distinguish between the self and foreign invaders. And till now we have discovered more than 80 autoimmune diseases. So the next part, that is how the immune system works, okay. Our immune system, that is defense mechanism of our body. So what are the normal functions? First, that is protects against bacteria, viruses and harmful substances, and produces antibodies to target foreign invaders. So what is our normal immune system function? Are to invade or acts against the bacteria, virus and harmful substances, and to produce antibodies for target the foreign invaders, and it is our defense mechanism of our body. And in case of autoimmunity, it produces antibodies that target the body's own tissue. The immune system the main function of immune system is to work against the bacteria, viruses and harmful substances. But in case of autoimmune disease, it starts producing on the antibodies that targets the own tissue. So if we make a diagram, then you can see that this is some healthy cells, and these are some foreign cells or foreign particles. And our immune system, this is like our immune system. Our immune system duty is to remove them, these blue cells. These are the foreign invaders, and these are healthy cells, okay. And it is our normal function that antibody will act against the foreign invaders and protect the healthy cells. But in case of autoimmunity, what happens? The immune system, the antibody come and destroy the healthy cells, and the antibodies that are produced that target body's own tissues which are healthy. Now we will discuss about the common type of autoimmune disease. What are the common types? So number 1, that is rheumatoid arthritis. Number 2, that is type 1 diabetes. Then psoriasis. Then number 4, that is lupus or systemic lupus erythematosus. Then number 5, that is multiple sclerosis, MS. The number 5, that is inflammatory bowel disease, IBD. You can see that one, you know that IBS, inflammatory bowel syndrome, this is under something that. So what are the commonest type? The number 1 is rheumatoid arthritis, number 2 is type 1 diabetes, number 3 is psoriasis, number 4 that is lupus, systemic lupus erythematosus, then number 5 that is multiple sclerosis, and number 6 that is inflammatory bowel disease. Now next, what are the causes and risk factors? First risk factor, that is exact cause are unknown. What are the cause behind the disease? That is exact cause is unknown. Then the environmental triggers like infection, stress, toxin, then genetic precipitation like runs in families, and hormonal factors more common in women. So let us discuss one by one. So first point, that is the exact cause. What is the exact cause behind that autoimmune disease is currently unknown. What are the main causes? That is unknown. This is a problem that we cannot determine how the actually disease is going on. This is one problem. Then number 2, that is the environmental triggers, ET, that is the infection, if the body has any infection or stress or toxin substances, these are one problem. Then number 3, that is genetic predisposition, genetic predisposition. So what is genetic predisposition? That is runs in families, and this disease is going on the family chain, like in case of it is like grandfather or granddaughter, then grandfather to the next generation, father or mother, then the grandson. These diseases come one by one in the families. Then number 4, that is hormonal factors. What are the factors? That is mostly present in case of female. Then if we go to the next slide, that is sign and symptom. What are the main sign and symptom in case of autoimmune disease? That is first of all, that is chronic fatigue and weakness. If any disease occurs, weakness is common. Then number 2, that is joint pain and swelling, joint pain and swelling. Then the skin rashes or changes, skin symptoms like skin problem, that is skin rashes and changes. Then some digestive issues, then frequent fever or inflammations. What are the common signs and symptoms? First one is chronic fatigue and weakness, second one is joint pain and swelling, number 3, that is skin rashes or changes, and number 4, that is digestive problem, and number 5, that is frequent fever or inflammation. Then we will come to know that how an autoimmune disease are diagnosed. How we will diagnose that this is an autoimmune disease, and how will differ from autoimmune disease and normal disease. So now our duty to determine that between the both diseases and autoimmune diseases. So first of all, we have to take the medical history of the patient and conduct a physical exam. Then number 2, that is imaging test for organ damage. Number 3, that is sometimes biopsy or affected tissues may be included. Number 4, that is blood test for autoantibodies. So if we discuss one by one again, first of all, whenever any patient comes to you, maybe it male or maybe it female, they come to you and they give you their medical history, their previous medical records, and any disease if they have or not. Then we will we will take the case taking and gather the signs and symptoms and make the totality of symptoms and conduct the physical exam. What are the problem in his or her body? Then we will done an imaging test for any organ damage. If we suspect any damage for any organ or any other part of the body, then we will done an imaging test for that organ damage confirmation. The number 3, sometimes biopsy or affected tissue. Biopsy is needed whenever we detect any cancerous substances present in the body or not. If the cancerous substance is detected or malignancy is detected, then we will conduct the biopsy. Then blood test for autoantibodies. If we found any type of sign and symptom, then we will found the blood test which will help us to determine the autoantibodies are present or not. Then what are the treatment and management for the autoimmune disease? For the autoimmune disease, there are some treatment and management methodologies like, first of all, the autoimmune diseases are not curable. These are manageable diseases. These cannot be cured completely. So we have to manage. First of all, we have to know that there are no cure possible till now. So our focus will be on controlling the disease, controlling the sign and symptom, and reducing the pain of that patient. So first of all, we have to know that there is no cure possible till now. Then we have some medication like immunosuppressants and anti-inflammatories and biologics. We can prescribe the patient immunosuppressant, but immunosuppressant is risky, that because if we prescribe immunosuppressant, then that will suppress the immune system of that body, then any disease can occur very rapidly. The patient must be kept in a safe place. Whenever any foreign particles cannot come, then patient may be safe. Then the lifestyle, we have to modify the lifestyle of the patient very rapidly. The patient must maintain a healthy diet, and the stress should be managed in balanced condition, and regular exercise is mandatory. And support groups and therapy. So first of all, we have to know that the autoimmune diseases are not curable, but we have to focus on controlling the symptoms, and some medication are also present like immunosuppressant, anti-inflammatories and biologics, which will help to manage the disease. And we have mainly focus on the lifestyle of that patient. We have to change the lifestyle. If the patient must not follow any sedimentary lifestyle, the patient must follow an active lifestyle like regular exercise, manage stress management and healthy diet. And it also support groups and therapies. Then living with an autoimmune disease, how the life is going on with an autoimmune disease patient, lifestyle, how the life is going. First of all, in case of autoimmune patient, we have to make or build a support system, and we have to maintain the regular checkups, then learning to manage the flares and remission, and advocating the self-care and mental health. The mental health is dramatically reduced in case of autoimmune patient, because this is an disorder or disease which cannot be cured completely, but we have to manage it. For managing the disease, we have to do the complete and regular checkup, and manage the flares and remissions, and advocating the self-care and mental health. Then what we have learned in today's lesson is, autoimmune diseases are chronic but manageable. These diseases cannot be cured, but these diseases can be managed, and this is a chronic disease. And lifestyle choices can help managing the symptoms, and early diagnosis improve quality of life. If we diagnose early, then the disease symptoms and disease signs and disease pain may be reduced in a little bit condition. If we summarize today's topic, so what is our today's topic? First of all, we have studied about autoimmune disease. First of all, we know that what is an autoimmune disease. So autoimmune disease is mainly whenever the immune system mistakenly attacks the body's own immune system or immune healthy cells, and whenever it fails to distinguish between the self and foreign invaders. And we have till now discovered nearly about 80 autoimmune diseases. Then how immune system works, we have known that the normal function of immune system is to protect against the bacteria or viruses and harmful substances, and produce antibodies to target the foreign invaders. Then autoimmunity, that is produces antibodies that target the body's own healthy tissues. Then the common type of autoimmune diseases, what are the common types? Then first of all, we have discussed about the rheumatoid arthritis, the gouty pain, then the type 1 diabetes, then psoriasis, then lupus, then multiple sclerosis, then inflammatory bowel disease. Then what are the causes and risk factors? Number one, that is exact cause is unknown. Then environmental triggers like infection, stress, and toxin. Then genetic predisposition, which runs in families one to another. Then hormonal factors, which is more common in case of women. And now the signs and symptoms: chronic fatigue and weakness, then joint pain and swelling, skin rashes, hair changes, then digestive issues or problems, then frequent fever or inflammation. Now we have discussed about the how the autoimmune diseases are diagnosed. In the first point, we have to take the medical history of that patient. Medical history. Then we have done the case taking. Then we have done the totality of symptoms, and then we have conduct the physical examination if needed. Then we will go to for imaging test. If the any organ is damaged, if suspect any organ damage, then we have to do the imaging test to confirm the organ damage. Then we sometimes we need biopsy if we found any risk for cancer or any risk for the malignancy. Then we must do biopsy for confirmation of that patient that he or she may be suffering from cancer or not. Then we have do the blood tests. So then we have done the blood test for which confirmation? Blood test for autoantibodies. Autoantibodies. Then the treatment and management. First of all, we have to know that there is no cure possible till now. In future may be possible, which is focused on controlling the symptom. Then we have some medication like immunosuppressant, anti-inflammatories and biologics, and the lifestyle control, that is healthy diet, stress management, and regular exercise, which also support groups and therapies. Now, lifestyle of the patient, how a patient living with an autoimmune disease, that is building a support system, importance of regular checkups, then learning to manage the flares and remission, and advocating the self-care and mental health. Then what you have know in this video, that is the autoimmune disease are chronic but manageable. Lifestyle choices can help manage the symptoms, but early diagnosis improves the quality of life. So this is our today's topic. If you have any query or any doubt, you can comment down in the comment section, and thank you so much for watching the entire video.